Hi everyone, welcome to the British Lymphology Society Lymphedema Awareness Week programme. I'm Margaret Snedden, Chair of BLS, and this is the fourth of our webinars. Thanks to everyone who's been helping to raise awareness of lymphedema this week, making people aware that it's not the rare condition that people imagine it to be, and that there are many causes and contributory factors. It can also affect all ages. Please keep sharing information on social media and amongst your colleagues, as it's still possible to register for the webinars that have been this week. And there are resources on the website to help with that. For the webinar programme, and today we're focusing on lymphedema in children and young people. We're extremely grateful to our Children's Lymphedema Specialist Interest Group, who have really worked hard to develop resources and support this week. Also thanks to our sponsors, Haddenham Healthcare, Essity and Juzo, who have been particularly generous in their support of the campaign. I'd particularly like to thank Haddenham, our platinum sponsor, and Natalie Phillips, lymphedema specialist and clinical manager, who is delivering today's presentation called Compression Therapy, Considerations for Children and Young Adults. Please note that any references to specific products are examples and does not imply endorsement by the BLS. After recording, we will have live questions and answers session. If you do want to ask a question, please click the question box in the bottom right of your screen and put them there. If you have any other comments or technical problems, please use the chat function. I hope you enjoyed today, and we'll see you back here shortly. Thank you.
Hello, my name is Natalie Phillips and I'm Clinical Manager at Haddenham Healthcare, and I'm also a lymphedema nurse specialist. I treat adults as part of my role, but today I've been asked by the British Lymphology Society and the Children's Lymphedema Specialist Interest Group to chat to you about the options available when using compression therapy for children and young adults. I'll discuss some of the considerations that should underpin decision making and discuss some of the products that can be used for children and young adults, as well as Haddenham Healthcare solutions. The Charter of Care for Children and Young People with Lymphedema, which was developed by the Children's Lymphedema Specialist Interest Group, is available to download from the British Lymphology Society. It discusses the pathway to diagnosis and treatment for the child or young person and the need for them to be treated as close to home as possible. However, this is problematic when there are only 24 clinics registered in the UK who can treat children and young adults. There is an increased burden on the family due to the lack of service provision and costs associated with travelling. The principles set out in the Charter are applicable to all aspects of care that the child receives, especially when considering the use of compression therapy. The child and family or carers must be involved in all aspects of care planning, and communication must be tailored in that it must be age appropriate, especially when measuring the child for compression. At all times, collaboration with other healthcare professionals is paramount in the context of the child. We may have to provide evidence to support extra prescribing of garments due to how quickly children grow, provide information for the school, nursery or college to ensure that they understand why that child or young adult is wearing compression, and to make considerations that, for example, allow for more time to change during physical education, especially if the child is using a different style of garment, and the need for the child or young adult to remain as active as possible, as sitting for long periods during lessons may cause them to become uncomfortable. There may be a discussion around behaviours as well that may be related to the frustrations of living with and growing up with lymphedema. and how that impacts day-to-day life and relationships with other children. There's no clear guidelines on the use of compression in children, and there is limited research, but we should always think about the physics of compression, in that we must always remember Laplace's law, which dictates that the greatest pressure will always be over the smallest circumference. Now, babies and children, even with lymphedema, will have quite small circumferences and less of a variation between the circumferences from ankle to thigh. The levels of compression used in adults are not required in children due to the limbs being shorter and smaller. There's a smaller surface area and a smaller circumference. Having discussed this with some of our colleagues from the Children's Lymphedema Specialist Interest Group, compression is rarely used in small babies, so it has to be age appropriate. In these instances where the babies are under the care of a service, parents are encouraged to increase movement, do exercises and skincare, as well as lymphatic drainage. And there is more of an emphasis placed on those treatments rather than compression. As I say, the compression must be age appropriate. It must not restrict movement or restrict normal childhood activities. In the study by Moffitt et al. 2019, an analysis of 20 children and young adults attending an international education camp were asked to use photographs or draw pictures to depict their description of living with lymphedema. They found that younger children who drew pictures made no reference to their lymphedema, but depicted normal activities with family members and friends. 4 of the older children did refer to their lymphedema, with one boy drawing a box, a black box in the corner of his drawing, which represented how cross his lymphedema made him. The research demonstrated how access to peer support can often have a positive effect on the child and young person's acceptance and ability to live with their lymphedema. In the UK, we're lucky that children can get peer support by attending the specialist children's camps or days like lympholetics, are great for increasing the child's acceptance. And seeing other children with the same condition and accessing peer support again can help them live a better life with lymphedema. So the clinicians I have discussed this with, in terms of where garments are concerned and compression, suggest that babies should just be encouraged with ordinary well-fitting socks, not compression, until they are up and about or crawling into walking, at which point they will opt for a custom-made garment that is in a RAL class 1, so that is 18 to 21 millimeters of mercury. And they will opt for flat knit fabrics. Now, flat knit fabrics are used because the construction and knitting process allows for garments to be made for very small limbs. They're knitted on a flatbed machine, which is depicted in the top right-hand corner of my presentation, which has a variable needle count, but this gives a fixed mesh size, which is more comfortable. A circular knit garment in these younger toddlers can be challenging to fit on smaller limbs, and that is due to how they are knitted, which is on a cylinder as a continuous loop of yarns with a constant needle count. So that creates a variable mesh size in that as the circumference of the leg gets bigger, so the mesh stretches. The elasticity of a circular knit garment may cause some discomfort in the child. Older children can have garments that are a little bit more pressure, so 23 to 32 millimeters of mercury. And in this instance, there are garments that are made from cut and sew fabrics, which use a pattern. So this pattern is drawn once measurements are received. And some of these fabrics are those that are used in burns. They tend to be more sheer and can have various patterns and colours, but do tend to have higher levels of compression. We have to bear in mind that as the child grows and gets older, they all develop at different rates. So you can't have garment recommendations or compression recommendations that are based on age. For example, 2 8-year-old children could be completely different heights, weights, and shapes. So clinical decision making is not only in relation to age, but also in relation to the size of the child. Puberty itself is starting earlier and earlier in some children, and whilst this brings with it changes in body, we have to be aware that emotional growth, regardless of if the child has lymphedema or not, occurs at different rates. The rates at which our children grow differ, but remeasuring of garments should, I would say, probably be every 3 months, which can be a challenge if the child and family have to travel far or ensure that appointments are made outside of school hours. We also have to ensure that more than 2 garments every 6 months are prescribed. Children are active, and in my experience, having grandchildren who haven't got lymphedema, they're very messy. They like to get dirty. So having 3 or 4 garments in rotation at any one time, at least, is a must. Assessment for compression should follow the same pathway that we use to assess adults in terms of where does the edema extend to? Is their digits swelling? What do the tissues feel like? And again, this must be made appropriate to that child with family members present and considering all safeguarding options. The Children's Lymphedema Specialist Interest Group talk about making measurement fun, and again, trying to include the child and family members in the aspects of measuring. So even, for example, having a younger child writing some of the measurements gets them involved and practices some maths. We also need to think about, does the child need a different style of garment for different activities? Because the compression should not restrict them from doing anything. Having different coloured and textured garments may promote a positive experience with compression, but we must also recognise that acceptance may change as the child moves into adolescence. In the Moffitt et al. 2019 study, adolescents showed how important it was to belong to a peer group, with one participant stating that she wanted to achieve a normal limb shape so she would fit in with her peer group. However, there was a mix of attitudes in relation to self-management, with some younger adolescents struggling to deal with the expectations that their parents had on them with their wishes to undertake daily routines. In this study, there were 3 adolescents who did not engage with taking photographs or in that part of it, which the authors stated highlighted the complex issues that adolescents face in describing how their lymphedema affects them. As the child gets older, their toolbox may get bigger, requiring different styles, which could include a mix of flat and circular knit garments, as well as wraps and bandages. We consider the use of wraps instead of bandaging, and this image on the right of the screen is drawn by one of the children in the Moffitt et al. Study. And in the article, the statement next to that picture reads, "I don't like my bandages and having to roll them up. Sometimes I am sad and cross." Children at the camps used peer support to learn the skills of self-bandaging, but this can be a burden to them. And on discussion with experienced clinicians, parents can be apprehensive of bandaging in the clinical setting because of the need for regular visits. There are instances where two-layer bandaging systems such as Coban have allowed for a reduced number of visits, but this then relies on bandages staying in place for a number of days due to waiting to attend clinics, or again, encouraging the patient or child to do that bandaging themselves. Wraps are becoming more widely used instead of bandaging to assist with supervised self-management and have demonstrated reduction in edema in adults. However, these can also be used with children, with custom-made variations available to fit smaller limbs. But one consideration, again, are the levels of compression and the fact that you get the greatest pressure over the smaller circumference. So it's advised that, for example, if you are using a Easy Wrap custom made, to use the light fabric rather than the strong. These are low profile and do help to give back some control, and hopefully will negate some of the negative impacts that the children experience having to use bandages. Other compression products that can be used are those that can be used for resting. Now, again, when discussing this with experienced clinicians, that there is different opinions on should a child be given compression to wear at night. Some would say that it's important to elevate the leg in bed and then allow the skin to have some time to breathe. But others are using garments such as ComfyWave and encouraging their children and young adults to pop these on when they get in from school or during nighttime resting. Now, there has been some reported benefits in children and young adults. And it is a unique garment in that it has whole knitting technology, which is used for when resting or overnight, and it's made from 100% organic undyed cotton, making it highly breathable. It has a seamless design which utilises a shaped area at the ankle to prevent cutting in, and due to its high elastic knit, it's easy to stretch to apply, but powerful enough to limit the stretch in response to any fluctuations with the swelling. It gives a therapeutic pressure up to 21 millimeters of mercury, and the sizing allows for fitting on limbs with an ankle circumference as small as 17 centimeters. As I say, there have been reported benefits of the use in children, and it can be used in combination with other compressions such as Easy Wrap in those who are at an age and size where higher levels of compression are appropriate, and again may negate the use of having to bandage. So for many years, Haddenham Healthcare have had the children's programme, which was launched about 10 years ago, for a certain range of products within our portfolio. We're really proud to provide solutions for lymphedema management for all patients, regardless of age. But what we decided to do was to say that when purchasing either hosiery or Easy Wrap, we will offer the second garment free of charge. And this is particularly useful when you have a child who needs a certain fabric that as a custom made may not be available through the GP or on FP10, or with a wrap, a custom made wrap that needs to be obtained and again isn't available on prescription. So we purchase the first garment, and then the second garment will be given free of charge. And this is one garment free of charge per limb per year to all children under 12. Now, to find out more about that, you can contact Haddenham Healthcare, where you just have to have a clinical referral form and disclaimer stating that the child is under 12. Other considerations and for the management of lymphedema. So other tools that you may use in the management of childhood lymphedema, one of them is kinesiotape, and a lot of our colleagues will use kinesiotape. I remember one colleague stating to me that she reported a little girl who did not like compression, tolerated kinesio very well, especially as it was pink. So that's quite a good option for them. Encouraging movement and drainage with the use of gadget and lymph drainage balls, which may help with simple lymphatic drainage or self-lymphatic drainage, and trying possible where to make self-management fun and reduce the burden of anxiety on the patient and family should really be a goal. Do make sure that families are aware of the resources that can be obtained from the Lymphedema Support Network, such as the Schools Pack. There's also the Big Book of Lymphedema, which aims to help children and families understand the condition by presenting useful information in colourful and eye-catching and child-friendly format. Just think about how much information and what other agencies we can put families and children and young adults in touch with to help them live with their lymphedema. I do hope that you found this session useful. There's a wealth of information available from both the British Lymphology Society website and the Lymphedema Support Network, who offer free membership to the LSN for children. I do look forward to answering any of your questions on compression therapy for children and young adults. I'll now leave you with some feedback from a couple of young adults on their experiences with using ComfyWave as part of their self-management regime.
Hi, my name's Ethan and I've got lymphedema. I really like my ComfyWave because they're nice and easy to get on. They're really comfy when I'm watching TV and playing my Xbox, and they help my lymphedema. Hope you like yours.
Hello, my name is Amy and I have lymphedema in both of my feet. I wear ComfyWave at night. I like my ComfyWave because I can limit wearing my hosiery in the day when I'm at school. The only thing I don't like as much about ComfyWave is when it comes to summer, it's really warm.
Hi, I think Natalie should be coming back. So thank you, Natalie, for that great and very comprehensive presentation and for joining us live for questions. We're also welcome Denise Hardy, lymphedema specialist and member of the British Lymphology Society Children's Lymphedema Specialist Interest Group, who's going to help with questions. So there were a couple of questions come up during the presentation, and Denise, you shared what you would do in response to someone's question about funding for garments, but could you say, maybe Natalie can help, about the general situation? Is it available in prescription at all? Do people have to make their own arrangements? Can you expand a little?
Should I go, Denise, or do you want to? I'll go. Yep. Okay. So in terms of any custom-made garments, such as flat knit garments, they're usually available on FP10, GP10 in the UK. I think the issue is that they're limited, aren't they? They get limited to 2 garments every 6 months. But I'd suggest that if it's in particular, that we would tend to write a letter to say this person needs more than that amount of garments because of growth. So yeah, the custom made garments are usually, I think, check with each individual company that people use to just check which modalities of garment are available.
Okay. Is there anything you'd want to add to that, Denise?
Yeah, I think working with children, one of the 24 clinics, I think the main thing, if you can get authorisation when you actually see the child for the first time. So I generally set out a plan of care for the year and suggest that the child will more regularly need their garments, because obviously they grow much more quickly than we do. So I try and get that into the very first letter to sort of preempt. And like most clinics, I don't. I have to have things that are on prescription. So, and I find that most things we can even get the circular knit made to measure. So most things generally, I think we can get for them, but they do need more. And as long as that's been authorised, which can prove difficult, but if it's organised and authorised, it's not a problem at all.
Okay, that's great. Thanks both. There's another question about assessment, and both vascular and neurological assessment in children and young people, and how often it should be undertaken. So I don't know who wants to go first.
Denise.
Yeah, again, it's just like an adult, absolutely crucial every time. Obviously, Dopplers are a little more difficult with children, as you might imagine. But doing a vascular assessment, just like we do with an adult, is what we do every single time. And as I say, just really as important as if you were doing an adult. So the BLS screening form is something that one can adopt. But yeah, absolutely imperative before fitting any child with compression of any kind.
Is that the vascular document you're referring to?
Indeed. Yeah.
I should tell people that it's not available at the moment because it's been reviewed, but we hope it will be available very soon. So thanks very much. And another question about kinesiotape, how helpful that is in children.
Yeah, again, sorry, Nat, I'm jumping in.
No, it's good.
I think, yeah, I mean, most children will have their compression garment. We tend to choose it with them to try and get them to choose the variety of garment that they like. But obviously, as Nat, your little patient suggested there, in the summertime, the likes of some of the garments are terribly hot, and when they're on holiday. So looking for alternatives is really helpful. And kinesiotape is one of those. There is a caution of being careful on the sand and in the sea with kinesiotape, of course, but generally most of the children that I've seen have found it really, really useful. And they like it too. It's different. And because a lot of their sporting heroes wear it, then they like to wear it too. But of course, it doesn't solve the problem with lymphedema. They have to try and wear their compression as well. So it's trying to get them to accommodate both and mix and match, perhaps, particularly in the summer months. But it can be really, really useful, particularly for problematic areas as well, for the genitals, in the trunk. That's really helpful.
Mm-hmm. It goes back to having that toolbox, doesn't it, for the child as well as the adult. Mm.
And there's a new tape, the 6D tape as well.
Yes.
That I found really helpful. It's a different take on the traditional kinesiotape, with a little tab on it that you can encourage the lymphatic system to drain more efficiently. So again, the children really like that because they can use it, they can implement it, they can play with it. So it can be really helpful for them. Yeah.
I seem to have done something wrong and I can't see energy now, but I think there was another question about the schools pack, but it's actually Lymphedema Support Network that produced that, and I know people find it really helpful, but if you contact the Lymphedema Support Network, they will be able to get it for you.
Yep, that's right. It's part of the children's pack that they provide, which is free of charge. Children can join the Lymphedema Support Network at no charge. The families are just given a free membership until they're 18.
That's brilliant. One of the other questions was to do with applicators for children and young people, given the shape and size of their limbs.
Yeah, there are no specific child applicators that I know of, but majority of those that are available can be used for children, apart from those that are really very small, the toddlers and the babies. And I tend to just obviously show parents how to apply the garments in those instances. But rubber gloves and rubber matting is really, really.
Oh. Denise
Okay, I still can't see anyone.
Okay. Denise has lost her internet connection.
I can see Natalie, and that's all I can see.
Denise is back. There she is.
So I can see Denise now. That's all. So I believe you can still see me, but
yes.
Is there another question that you can pick up if you can see the screen?
I think.
I had a question come through about genital swelling in children, and that's not common, I have to say. It's not something that I see all the time, but I have to say it's one that I've particularly struggled with latterly, mainly because, and I'm being upfront and honest here, this child I'd had from being a wee baby, and he's now coming up going to an adult service. So I've known him a long, long time. And he has developed scrotal swelling latterly in the last year or so. And I think you might appreciate and empathise how difficult that might be for knowing a child growing up to suddenly having to assess him for appropriate compression garments for that particular area. So, but it is to bear in mind that, of course, like our adults as well, that the lymphedema can extend beyond the limb into the genitals, into the trunk. And it's something we need to be really mindful of and implement appropriate treatment, whether it be bandaging or indeed compression garments. But it's not easy, and I hold my hands up for that, it was quite a challenge that we did overcome, but still a great challenge as well. So, yeah.
Thanks. Yes, it's a very distressing thing for anybody, but it must be particularly so for children.
Yes, absolutely.
Is there another question?
I don't think so.
If not, can I butt in, Margaret, and say, not on compression per se, but for those who are listening who are perhaps not members of the Children's Lymphedema Special Interest Group, to think about joining, and particularly in regard to the fact that, as Nat said, there's only 24 clinics in the UK that see children. So for my particular example, I'm the Northwest, the Lake District. The nearest clinic to me going north is across to the other side of the country, to the northeast, or going up towards Glasgow. So those children in between have got a very long distance to travel. So if services can think about seeing children, it would be really helpful. There's not a great deal of difference from treating children to adults, apart from making the appointments much more fun. So they're great to do and to involve. But I do encourage everybody to think about trying to include children in their caseloads, if at all possible, because it would just help, I think, to ensure that children don't have so far to travel to the main clinics in London and Derby. So it's just a plea, really, to other practitioners to come on board.
It's probably worth saying, Denise, that Natalie showed the map and the list of where there are services that see children, although they might have them specially assessed by Derby and London. But if anybody wants to know specifically where the services are, they can contact the BLS and you will point them in the right direction.
Absolutely.
There is another question from Matt, who's been asked by a Lymphedema United member if there's a forum or platform for parents with children that have lymphedema to meet and seek support.
Yeah, our
on
lympholetics meeting that we hold every 2 years, that's due to go ahead in September this year in Bracknell in September the 21st, if anybody's interested or got children that they think would like to attend. That group who've been going since 2014 we set up, there's a core group of parents who still have a sort of WhatsApp group, and they provide lots of great support for each other. So again, I would encourage you to contact the children's group, and we will point you in the right direction to get that support. So yes, it is available. Not, as you might imagine, it's not a huge group, but it is there and extremely useful for many parents who've got children with lymphedema.
Okay. Are there any other questions?
No, I don't think so.
Okay. Anything else you would like to add, either Natalie or Denise?
Again, it's just a plea from my side that if you do have children with lymphedema, again, that the Lympholetics event, which is a really fun day for children with lymphedema and their siblings and their families, it will be held on the 21st of September in Bracknell, London this year, and application forms are on the BLS website in the children's pages. So I'd be grateful for that.
Yes, the people who have been on, the young people who have had lymphedema have been on this week, have all said what a really, really amazing experience it's been, and their parents to attend this. So I think if anybody has children, young people on their clinic lists or know of anybody who might be interested to go, they should go on the website, and there is a form that they can express an interest in it. So I think it's really worthwhile, and I know that you all volunteer and you get personalities to attend and make it interesting, and there's also education too. So a very worthwhile event.
Absolutely.
So if there aren't any other questions coming up, you can't see any, can you?
No.
No. Okay. We'll probably just close there and just thank you both, Natalie and Denise, for being with us today, for answering questions, and for all that you're doing for people with lymphedema, particularly the children and young people that we're talking about this week. Thank you to everyone who has joined today. Remember that there are still, there's tomorrow's webinar, but you can still register for the others earlier in the week, and please share that with other people in case they would want to also tune into it. There's more information on the Children's Specialist Interest Group webpage on the website, so have a look there. And there will be more coming. There is a guideline document who will be coming, and the easiest way to make sure that you get that is to sign up for free as a friend of BLS, and we would notify you as soon as that becomes available. So I hope you enjoyed today, and please join us tomorrow. And happy Lymphedema Awareness Week to everybody. Thank you.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye.